So side effects are different for everybody, and weight gain is no exception to that. And I think one of the important things to recognise with antidepressants and weight gain is that depression itself, depression, anxiety, mental health conditions can in themselves cause weight gain. And so sometimes starting an antidepressant can actually be helpful because it treats the mental health condition, and that can then enable people to actually manage their health and their well-being, and then the weight themselves more effectively. So in that way, actually, antidepressants can sometimes help with weight loss rather than causing weight gain. Having said that, there are some antidepressants that are more associated with weight gain than others. And that means more associated in terms of the general population. So when we're looking at everybody, and as I say, side effects are very different for everybody. So just because one medicine is more associated with weight gain, so it might be slightly more common on a population level, doesn't by any means mean that it's a guaranteed side effect for everybody. So I think the other part then about side effects in general, but weight gain is a good example, is where taking a really good medication history is actually really important, because what's happened in the past in terms of adverse effects can really inform the future. And by knowing what's happened in the past, we can try to help plan for what could happen again and then try and prevent it. Because I think, as we all know, prevention with weight gain is much easier than trying to lose it once it's already happened. So weight gain is by no means guaranteed, slightly more common with some medicines than others, but is certainly something that can be managed and can be prevented. The other thing to think about is that in some cases, it may be that the benefit that somebody will get from a medication, including an antidepressant, might actually outweigh the downside of that particular side effect. And of course, that balance is going to be very different for every person, which is why really individualised decision making about medication is so important.